Hi there, my name is Coach Sherry. Sherry Gazid. I'm a member of Balance in Mind, who is bringing this wonderful parent chat series to you. I'm a volunteer, as is everyone else in our organization. So I'll just put a quick plug in for that. If you are interested in volunteering, we would love to have you be part of the organization. You can bring whatever skill set you have to us, and we will put you to good use, and you can have an impact on bringing mental health awareness to our community, to parents, and that of course trickles down to our kids, so we can really be making a difference. Tonight, we are talking about anxiety in elementary age children. We're excited to bring this specifically to you because a lot of our stuff spans all of the age groups, but this one is specifically for elementary age. So we are really excited to have you here and to bring you this information. Tonight, we have Dr. Lynette Dufton, who is joining us, and she is going to be sharing her wisdom with us. I will read you her bio because it is impressive. I want you to know that you are in good hands tonight. Dr. Dufton has over a decade of practice experience specializing in supporting parents, teens, children, and families struggling with anxiety, depression, stress, and behavioral issues. Dr. Dufton has given multiple presentations and published numerous papers on the topics of pediatric psychology and disseminating evidence-based practice. Dr. Dufton has acted as a clinical assistant professor in the University of Washington's Department of Psychology, which we all know is an amazing department, where she supervised clinical psychology graduate students. She spent 8 years in this role while simultaneously managing a private practice. That's quite a feat right there. Passionate about supporting mothers and new parents, Dr. Dufton has organized support groups and volunteered as a parent coach to help parents navigate the challenges of raising children from infancy through the teenage years. And she has 3 school-age children of her own, including a set of identical twins. In addition to spending time with her family, her extracurricular interests include yoga, hiking, knitting, and crochet, which all sounds extremely relaxing. Welcome, Lynette. I appreciate you being here tonight.
Thank you so much, Sherry. And it is my pleasure to be here. I'm very honored that you invited me to come and speak with you. This is a topic that I am very interested in and passionate about. I began my journey in the field of mental health and clinical psychology as a graduate student, where I wrote my dissertation on the comorbidity between anxiety and recurrent abdominal pain. And that led me on a path where I continue to do research and get a lot of expertise in working with children and families where anxiety is an issue and a source of challenge. And then about 10 years ago, the boy that you see in this photo was born. And I got to begin to implement and practice what I preach, because my child, who is an amazing, intelligent, creative, verbal, smart kid, also is challenged with anxiety. And so I'm going to be speaking to you from both my background in research and training, as well as my personal experience as a parent in managing anxiety in kids this age. He's currently 10 years old and he's a 4th grader. Although I've done lots of presentations in the past, this is my first time doing a presentation via Zoom. And it's unusual for me to not see my audience. And so I want to encourage everybody to please ask questions. There's a Q&A box that you can ask questions. There's also the chat. Sherry's going to help me monitor that, and I welcome interruptions. I welcome you to please ask me questions if you're confused about anything that I'm saying, or if you want some more specifics or details. I encourage you to please ask, and I will try to regularly check in and see how you're doing, and if you have any questions.
Great. And I just want to remind everybody, it's good to put the questions in the Q&A box so those stay nice and tidy where we can find them. The chat box scrolls up, so we're going to be looking at that, but your questions you can throw in the Q&A box, and it doesn't interrupt us. So if you think of a question right now, for instance, you can put it in there and we will get to it when we have a chance.
Okay, excellent. Okay, so okay, there we go. I thought that it would be a pertinent and good place to start to share with you a headline from the New York Times that just was published a couple of weeks ago, where the New York Times was talking about how there's a panel of experts that recently stated that children 8 years old and older should be screened for anxiety. Clearly, anxiety symptoms are prevalent and they've been exacerbated by the pandemic. And in particular, the reason why the experts are stating that we should be looking at this more closely is that if we can catch some of these kids earlier, 8, but you can also, screen even younger than 8. The evidence for being able to help and support them is so strong. And you can really, as a parent, as a grandparent, as a caregiver, there are things that you can do to help support these children so that anxiety may not develop into something more serious that could impact their functioning as they grow older. And so I thought that was timely, and I thought that it was important for us to just kind of revisit and look at how this is impacting the population here in the US, but also globally. The prevalence rate of an anxiety disorder diagnosis in this age group prior to the pandemic was about 8 to 10%. But there was a meta-analysis that was just published last year that showed that the prevalence rates of anxiety and depression have doubled across the globe worldwide. Their estimates were that currently with the pandemic going on, the rates of anxiety disorders have increased to about 20.3%. So this is a serious issue. But luckily, the one thing that the mental health community does really well is help people with anxiety. We're not so good at treating a lot of things, but when it comes to anxiety, we know that there are some very successful strategies that we can implement in order to be able to support people who are feeling anxious. And in particular, because parents and caregivers are with their kids so much, if you can learn these skills and you can implement them with your kid, it can be so impactful and really be able to help your child and help the family system as a whole.
Lynette, can I ask you a question here? When it says pre-adolescence, what age group does that include? Anything pre-adolescent, or is that a certain age?
Typically, they're looking at like 6 to 12.
Okay.
Is usually how they'll break that down. And then 5 and under is considered like preschool age.
Great.
Yeah. Okay. So today, this was what I thought generally my outline would be. I'm going to speak briefly about what anxiety is and what it looks like in elementary age kids. But we're going to spend the bulk of the time talking about what you can do when your child is anxious, some tips and techniques and strategies that you can use to help your child. And then towards the end, we'll spend a little bit of time looking at how can you tell the difference between anxiety, even though if it's difficult and challenging, but kind of falls more on the spectrum of normal anxiety, to something that might need more support and help, perhaps evaluation or intervention by a professional. And if that's the case, I do have a few resources available that I can share with you as well. So I wanted to ask the group, and perhaps this might be a place to put in the chat box, when you see your child exhibiting symptoms of anxiety or feeling anxious or worried, what does that look like? What are you seeing in your kids?
This is a good one. So you can put that answer in the chat box. There's no right or wrong here. This is not a quiz, not a pop quiz at all. All right. So people are mentioning tummy aches, which of course that's how you started your journey, your career. Increase in nightmares, brain block. Body feels like it can't calm down, anger, sleeping problems, hyperventilating, anger issues, separation fears, fear of a new situation, acting out, not wanting to be alone, can't stop the thinking. Yeah. It sounds like all of you are very aware of what's going on with your kids and what they're experiencing. Throwing up, crying bathroom, staying home, freezing. Yeah.
Excellent. So you guys hit the nail on the head. With this age group in particular, the things that you're describing are very common in this age group, and it looks a little different from older kids and adults. But in particular, what you're describing is what we tend to see. There we go. So what we're seeing is what you just described. That, oh dear, sorry about that. The physical complaints, the tummy ache, the headache. And part of the reason why we see that with kids and with adults is that when we're feeling anxious, our fight or flight response gets triggered. And one of the things that happens is that our digestion shuts down. And when that shuts down, we start to feel yucky. And we might have a stomach ache, we might have a headache because of the muscle tension, all the things that you're describing. What we see a lot of too with little kids and teenagers is irritability or anger outbursts. And part of that is because they're so tense that any little thing will get under their skin and make them irritable. The anger also can come from this resistance to having to cope with what it is that's triggering their anxiety. And at the bottom, I have their oppositional behavior. Oftentimes, some of the things that we see in this age group is misconstrued as oppositional behavior, that this kid is just stubborn, this kid won't listen to anything that I say. But in fact, what's really driving it is fear. And the child does not want to have to face their fear, doesn't want to have to engage with the thing that's triggering their anxiety. And so a lot of the things that you see, trouble falling asleep or staying asleep, feeling angry, trying to have these physical complaints, is all to avoid the thing that is making them anxious. And so one of the things that I will encourage you to do after we're over here is to reflect on how anxiety presents in particular for your kid. I think if you can get a really good sense and really know what it looks like for your child, because it's going to be different than the child in the other family or other kids, that's going to help you know that this behavior that you're seeing that might be challenging is driven by anxiety and not something else. And that's going to help guide you into your approach, how you're going to respond to that child. So, for example, if your child is just saying no because they don't want to turn off their iPad and have to go to bed, and they're just having a really tough night because they're feeling kind of angry and stubborn, that's really different from a child who's saying no and really resisting because they're scared of bedtime and they don't want to have to sleep in their bed by themselves. Or there's something else that might be driving that's related to anxiety rather than kind of like a typical behavioral issue. And so the way that you would approach that as a parent is going to change. Does that make sense? Any questions about that?
Yeah. This, I think that one of the things, Lynette, that is so important on this discussion right here is that a lot of times if there's oppositional defiance or, things like that, then parents feel like, okay, I just need to be more in control. I just need to, hold the boundaries. I need to not be flexible. But when you understand that it's coming from this anxiety, it really gives you a different outlook on how you're going to parent this child.
Yeah, absolutely. Great. So.
And I think, by the way, in the chat box, I think we hit every single thing that you had on your slides. So
yes, we did.
That's
well done. Okay, so I'm going to be repeating this throughout the presentation. Anxiety in itself is not bad. We don't want to get rid of our anxiety. There's a reason why human beings evolved with having anxiety with us. It gives us motivation. Sherry and I were having a chat before the presentation, and she was talking about how you have this peak of motivation when you feel anxious, and it helps propel you and compel you to get a task done or study for a test or do whatever it is that you need to do. And also, it's our alarm system. If there's a danger present, we need our anxiety to get us prepared for that so that we can escape or avoid or run away or fight back or do any of those things that we need to do. That being said, there are times where our anxiety is not super helpful. And this happens to everybody, not just people who have more extreme anxiety, but it can be particularly unhelpful when a person, a child, will feel the anxiety more regularly, more intensely, and most importantly, when it starts to interfere with the things that they want to do or the things that they have to do. That's when it becomes a problem. And I'll talk more about this too. This is going to help you differentiate whether your child might have like anxiety that's challenging versus anxiety that might benefit from some professional intervention. It's that line of if it starts to interfere and you can't get your child to be able to do the things that they have to do or they want to do, or maybe that another kid, that average kid, the typical kid, their age range would be doing at this time. Okay, so now we're going to get into the meat of what we want to talk about tonight, which is what are things that we can do or not do when our kids are feeling anxious, how to help and support them. Before I get into that, is there any questions or anything that I should address?
We have one, but I imagine we'll get to this at the end. Are there any resources that you can recommend?
Okay.
I imagine we're going to get to that. So don't worry, Jane, we will answer that.
Okay, great. All right, so the first tip is really more of a mindset. The question to ask yourself is, what is the goal? And as I was saying earlier, the goal is not to eliminate anxiety. We need anxiety, right? But the goal is to help your child be able to manage their anxious feelings. So if you bring your child to a situation where they become anxious and they become tearful and clingy and they start to cry, and you immediately sweep them up and take them away, then what happens is that your child is going to learn that avoidance is a really quick and easy way to be able to cope with whatever it is that makes them feel anxious. And they're not given the opportunity to stick it out, practice any kind of coping skills, allow you to coach them or help them. And it also teaches them that, or it doesn't give them the opportunity to learn that they can actually experience the feeling of anxiety as it gets higher and eventually lowers the longer that they stay in the situation that makes them feel anxious. Because I guarantee you, and I'm sure you've had experiences in your own life, that over time your anxiety will decrease as long as you stick with it and you don't keep avoiding. This is an important question to remind yourself when you are in a situation with your child where every fiber of your being wants to save your child. I have been there where your child might be throwing a major fit. You hear them with the tears and the screaming, and there's like, you want anything you can do to just make them stop suffering. And it's true that the easiest thing would be to leave and to get the child out of that situation or give in to their request or demand. But that's the most important time to really hold steady and stay strong, and to know that in the long term, this will ultimately benefit your kid if you can stick with it and help them.
Right. I love that. One example is if your kid doesn't like to brush their teeth, right? They're going to have to learn how to do it. You don't just say, okay, never mind, we're not going to brush teeth. This is, it's causing you distress. We're just going to stop doing it. You have to teach them how to get through this, because you can't be there every step of the way, and they can't avoid everything that creates anxiety. So I love this.
Yeah, absolutely. And this is just to kind of highlight and underline this point, that the more that you avoid things, it actually ultimately reinforces the anxiety and can cause bigger and more severe problems long term. So it's really important to just keep at it and stick with it and stay strong, and know that ultimately, even though your child is potentially yelling and screaming and hating you in the moment, you're doing what's best for them and ultimately what's going to serve them.
And that's a hard one to follow through with when you're in public, right? When people
yeah.
are looking at you, you just gotta not worry about them, right? Just know you're doing what's right for your child.
Absolutely. Okay, so some more specific tips here. This is the idea of a leading question as it applies to anxiety. I'm going to start with just an example. This is so common for parents to do. Let's say that you have a child that's in school and you know that they have something coming up, like a big test or a science fair. It's really natural and normal to ask, are you anxious about the big test? Are you worried about the science fair, right? And what that does is that actually plants the idea in the child's mind that maybe they should be anxious if they weren't already. Or, why would my mom be asking me if I'm anxious? Does she think I am anxious? Maybe I am. And then they start to, consider whether or not they are. And so in this context, when we're talking about leading questions, what we mean is that if you're going to use a feeling word and you're at risk of telling the child how to feel about something, which could actually make them feel the way that you're telling them. And so alternatively, what would work better would be to just ask them, how are you feeling? How are you feeling about the big test? How are you feeling about the science fair? This gives your child an opportunity to reflect on that question and then share with you. And you might be surprised. I can't tell you the number of times where I have been surprised by one of my kids when I've asked them how they felt about something that I was sure that they would be anxious about, but their response was like, oh, I'm really excited, or I haven't even thought about that, or yeah, no, it's like boring, or not, nothing at all, right? And so this is, or they might respond that they're feeling anxious, in which case you're going to be able to talk to them, and I'll address that in a little bit, but that this gives the kid an opportunity to really reflect on what's going on for them.
I want to ask you a question for the chat box, if you don't mind, Lynette.
Yeah,
I'm
of course.
curious about what the kind of anxiety triggers are for the kids for the parents who are watching. What are your triggers for your kids, or what are the big things? Usually there's like, 2 or 3 that kids have. I'm just curious. Right. But go ahead and I'll look at those later.
No, I actually, thank you, Sherry. I meant to encourage people to share that if they were willing. Because there's also, I didn't have this included in my presentation, but there's a list of the common fears for kids that are in this age range. I'm going to guess that those are probably something that your kids are experiencing, which on the one hand can be really reassuring that like your kid's not, off the charts or, weird for being nervous about something. But it also, it indicates that like having anxieties are fairly common, and great, we can address it. Once we know what it is, and it's not just some kind of big nefarious thing, we can actually figure out how to handle it and cope with it.
Exactly. And it's nice to know other people are going through the same thing, even though it doesn't alleviate anything you're going through. It's like, okay, I'm not the only one.
Yeah, absolutely. And as people are writing these, I think we'll use these when we talk about this slide here. So once you might introduce the conversation, like, how are you feeling about X, Y, and Z? Now you have an opportunity, because if the child says, yeah, I'm feeling really anxious or worried, if they have that type of language, then you have an opportunity to talk about it with them. And this is a technique that therapists use a lot, and coaches and teachers, which is kind of like a Socratic questioning approach, where you are encouraging the child with your help to figure out not only what it is that they're feeling anxious about, but if that thing happened, what would they do? How would they handle it? So Sherry, could you tell me some of the things that have come up in the chat box?
Absolutely. We've got routine changes, trying something new, sleeping in own bed, the time test in school, that's a big one, like the multiplication facts, just surprises. Birthdays, entering a new classroom, taking a COVID test. I totally get that one. Being left alone, new people, places, crowds, all post-COVID. And yeah, a lot of these things have been kind of exacerbated by COVID, of course. Big events like holidays, school, getting sick, global warming, something happening to family members, spiders. Oh my gosh, I'm totally arachnophobic here. Trying new foods, spiders, sensory induced triggers, all bugs, homework, being alone, even in the next room, illness and pains, having a hard time making friends. Almost done here. Let's see, when he's focused on something and we have to do something else, time, when someone is angry, math, and food.
Right. Okay.
A lot in there.
That's a fantastic, I mean, okay, maybe that's the right descriptor. That's a great list.
Yes.
Because I'm so relating to this. This is true for all three of my kids, in particular my son, who's the more anxious one. One that stuck out in my head was the fear of birthday parties. My son has more of like a social anxiety bent to his anxiety, and he does not like to go to birthday parties or new activities, any place, even if there are friends there that he knows. There's just something that's really tough for him about doing stuff like that, particularly if it's a drop-off situation and I might not be there to be able to help him. And so one of the things that we will do is we'll talk through what it is specifically that he's scared of. So in the case of a birthday party, when you're talking to your child, you can say, so what are you scared of? What do you feel nervous about? Oh, that I won't know anybody there, or that no one will want to play with me, that no one will talk to me, that I'll have brought a present that the birthday person hates, and then everybody will make fun of me, or that I'll spill food all over my shirt, or, you can go on and on and on. And so what you can do is kind of come up with a list of the things that the child is feeling anxious about, and then try to figure out a plan. Okay, so let's say that you don't know anybody there. What will you do? How will you handle it? Do you think you could introduce yourself to somebody? How would you do that? Can we role play it? Sometimes kids are willing to do that, sometimes not. Now, I will say it's best to have these conversations when your child is in a calm space, not like the hour before the birthday party. Right. Something that you have to plan for and make sure that you're in a really good place too. And sometimes it can't just happen all at once. It has to happen like with lots of breaks in between. But if you can do that, it helps reassure the child that that they can be able to cope with whatever situation might come. And then you can also be able to express your own confidence that your child's going to be able to handle it and it's going to be okay. And you can say that with a lot of reassurance because you've just gone over a plan with your child.
Right. And the great thing is you're building the skill for later, because you're teaching them to go through this list and problem solve, which you're not going to be there maybe in middle school even, or high school. So they're starting to learn that, hey, this is how we're going to deal with it when these anxiety triggers start coming up.
Yeah, absolutely. And so while you're having this conversation, it's really important that you're expressing positive but realistic expectations. And so what that means is that you can't promise your child that that terrible thing that they're worried about happening won't happen. Nobody can promise that. Most of the time, our anxiety is around things that are completely out of our control, right? But what you can do is express confidence that your child will be okay and that they're going to be able to manage it. And that it's, I found that it's particularly reassuring when I say, like, I would never ask you to do something if I didn't think you could handle it. I know that you can go to this birthday party. You're right. You might have a miserable time. You might not be able to find a friend to play with. You might not be able to talk to anybody, and it might be really boring, but I promise you, you're going to be okay. I'll pick you up and you're not going to die. Right. And so I think that it's really important, like your comportment and the way that you're engaging this conversation is really important. And again, too, reminding them that the more that they do these things, their anxiety about it is going to get better over time.
Right. There's a really good question here. Does anxiety always stem from fear?
Does anxiety always stem from fear? Wow, what a great question. I would say no. Sometimes anxiety can happen because it's a reflex that our mind will then carry forth through rumination. So that, like, for example, well, let me backtrack on that. I wonder if what you're asking is if it's always possible to drill down and find the source of the anxiety to be able to have these types of conversations. Is that kind of the question?
And we'll see if you want to clarify that.
Yeah.
Asked. Yeah, and I like one of the things that I've seen with the clients I work with anxiety is sometimes they have kind of this anxiety energy that's kind of constantly there, right? And if you ask them what's the trigger, they can't drill down. It's like it's just always kind of there. And sometimes I find with those clients, they attach that anxiety to something because they're trying to look for a reason for this fear and this anxiety, but it's really not that thing. It's just this feeling. So it's more of the physiological than the fear itself. So that might kind of relate to this. Let's see. Emil said kind of, maybe that's what she was asking.
Okay. Yeah, I think you put it really nicely, Sherry, which is sometimes it is difficult to pinpoint what is triggering the anxiety. And like, it's to be quite frank, it's a lot easier if it's like, oh, my child is scared of a spider and therefore come up with a plan to cope with that. Or, my child is scared of going to the birthday party, rather than it just being like a generalized anxiety. And if that's the case, and it's really difficult to pinpoint, then you would probably move less towards doing more of the thinking or cognitive work and do some more like basic anxiety management skills, like taking deep breaths, doing relaxation, and trying to get them into a space where they're able to think more clearly or engage in activities that their physiological arousal is keeping them from being able to do.
I love that. Somebody said their kids say, I don't know, all the time, which that may be a more generalized anxiety.
Yeah. Yeah. So I just want to touch briefly on this idea of validation and that when you're having these conversations with your kids, it is important that you don't necessarily minimize what the child is saying in terms of them feeling anxious, but you can practice validating. And so an example of that would be if a child is really terrified of having to get a shot at a doctor's appointment, it's natural to say something like, oh, it only hurt for a minute. It's going to go really fast. You're going to be just fine. It's not that big of a deal. And all of that is done because you care about your child and you don't want them to feel stressed about this. But what that's doing is it's really invalidating their current experience. And so it's okay for you to say, you're really scared about getting a shot. I totally get that. I get nervous before I get shots too. I know what that feels like. It's okay. And even if you feel scared, it's all right. I know that you're going to be able to do this, and I'm going to be with you the whole time, right? And so that's a way to be able to empathize and validate what their experience is, and also encourage them, once again, that you have confidence that they can cope and help support them in a way that's not minimizing what their experience is.
There was a key word in there that you used. You used and rather than but. So don't say, I know you are scared, but this isn't a big deal, because that's invalidating the first part, right? So that's a huge change there. That's really important.
Yes, thank you. Another thing that's really important is sometimes we will inadvertently reinforce the experience of anxiety through our nonverbal cues and also our tone of voice. So I have a picture of a dog, and a very common fear in this age group is fear of dogs. And so you can imagine that if you're out for a walk with your child and somebody walking their dog comes around the corner, you know that your child is scared of dogs, but you want to be supportive. And so you try to be brave and bold for them, but and you say like, oh, here's a dog. It's okay. Everything's going to be fine. The dog's on a leash and or whatever it is that you might be saying, but your body is stiff. You kind of put your arm around your child, you move them to the side, you snuggle them up. What you're doing is like, you're expecting them to feel anxious. And by your body language and your tone of voice, you're starting to encourage that. And then they turn to you and they expect that kind of reassurance. And it also diminishes their ability to think that they can actually manage it and cope with it. So, alternatively, a way to be able to approach that would be to just wait and see what happens. When that dog comes, you might notice it. Don't say anything at all. See if your child reacts. And if your child does react, then you can respond to it. And then try to modulate your voice and notice your own physiological reaction and your own movements, and make sure that you're not contributing to an anxious kind of like feeling in the air.
This is huge. It's really huge. There's research that shows that we as parents, when we get anxious, the physiological piece of it can transfer to our kids. So even if you're like, trying to have the brave face, they catch on to that. So we have to regulate that. But what you're saying here is so true about this anxiety snowball, is how I kind of describe it to parents, that our kids are anxious. So we begin to get anxious about our kids getting anxious. And then as they get older and they're more aware of you, your kids get anxious about making mom or dad anxious, and it just keeps getting bigger. So we have to be aware so we can cut the pattern there.
Yeah, absolutely. I want to just touch really briefly, for the sake of time, this idea of a habituation curve. And I've said this before, but it really bears repeating, that habituation just means that it's the fancy psychology word that the more you do something, the less scary it will be over time. And when I talk to kids about this, I will often share the metaphor of a roller coaster, where if it's your first time going on a roller coaster and you're waiting in line, you're going to feel super duper anxious while you're waiting. But if you go on that roller coaster and you get off and you immediately get back into line, you're probably still going to feel a little anxious about going on the roller coaster, but you're not going to feel as anxious as you were the first time, because you've already been on it and you knew what it was like. And if you kept doing that all day long and all you did was ride on that roller coaster, by the end of the day, you're suddenly not going to feel anxious about it at all. You're going to probably be pretty bored of riding the roller coaster and want to do something different. And that's the same thing when we encourage our child to repeatedly confront the thing that's triggering their anxiety will decrease over time. It might not drop to zero. It might not go quickly, but I guarantee you, if you stick with it, it will eventually drop over time.
And I just want to answer a couple of questions here.
Okay.
Someone was asking, what did the last circle say in the previous slide? Do you mind going back to that so we can see one before that, I think? That one there.
There.
Okay. You want to read it out loud?
Sure. This is just some language that you can use. I know that you're scared, and that's okay. And I'm here, and I'm going to help you get through this.
Right. And then somebody asked, what if you do have the kid who says, I don't know, when you're asking them, why they're feeling that way or how they feel?
Yeah, I think it depends on the situation. If it's a situation where you need to get your child to go to school, or, there's an appointment, or there's something in particular that you need to do, you're going to address that differently than if you're just having like a general conversation and you're trying to figure out what's going on with your child. And it also depends too on the level of anxiety that they're experiencing currently. We talked a little bit before that sometimes you might just need to start with some basic anxiety management coping skills, practicing deep breathing, progressive muscle relaxation. Distraction has a role to maybe get your child to think about something different that's calming and relaxing. But if there's also, like if it's a situation where you need to get out the door and your child is just like really fighting you to be able to go to school, then you're just going to have to like kind of do all of the behavior management techniques that you probably implement all the time. Reward system, like trying to do whatever you can to get out the door, and then revisit it later when your child is calm and they're no longer in that high anxiety triggered state. It's really difficult to have those types of conversations about what's triggering their anxiety when they're feeling anxious. Those are best had when they're calm and relaxed.
Yeah. And sometimes it's a hard question to answer, right? I know there have been times where I just felt out of sorts and like my husband is like, what's wrong? I'm like, I don't know. So sometimes our kids are going to be like that too. They just don't know, right? And especially the older elementary kids who have the puberty, chemicals starting to kick in, they really might not know, but you can give them a chance to think about it anyway.
And there's something else too, which is you can always ask them, validate, sometimes I don't know why I'm feeling anxious. What can I do to help right now? What do you need? And offer, would you like a hug? Would you like to go lie down in a dark room and rest for a little bit? If that's possible, of course. But maybe sometimes shifting the focus away from like, why am I feeling so anxious? And just shifting to soothing or coping or offering to be able to help them can really help in the moment.
Love that. Thank you.
Okay. And so the thing is about anxiety is that the hardest, the way when we feel it most intensely is right before the bad thing is going to happen. And so if it's possible to keep the anticipatory period short, that tends to be the most helpful. That being said, my son, he hates surprises. And so there's a real delicate balance between keeping the anticipatory period short, but also giving him enough notice so that it doesn't turn into a real problem. For example, he hates going to the dentist. And what we have discovered together, and I'm fortunate that my kid is very verbal and is able to like have these conversations with me, is that the best strategy for him is that I will tell him about 2 weeks before the appointment, and then we don't talk about it at all until the day before. So he just wants to have that heads up. And then as we get closer to the time where he has to cope with something, that's when we'll like have the conversation. Okay, so what's it going to look like? What will happen at the dentist? How will you cope with it? If it hurts, what can you do? All those types of things. So you'll have to kind of figure that out for your kid. And for the parents and caregivers of younger kids, that's going to be really challenging to do. It's going to be a little bit of like experimentation. But as your child gets older and they can talk with you about these things, then you'll be able to come up with a plan together. And then lastly, we talked about this a little bit, but it is so important for you to model coping with anxiety successfully. And it doesn't have to be like a super big dramatic thing. The way that you can model this is it can be like super indirect, and it's a really effective way to teach your kid. So for example, at the end of a day, you can be talking to your partner within earshot of your child and just say, oh man, today I had this really big presentation at work. I was feeling really nervous about it, but right before I walked into the room, I took some deep breaths and I reminded myself that I really prepared as best as I could. And then, during the presentation, I stumbled over a few of my words and I even forgot something that was really important, but you know what, like nobody seemed to notice and it was all okay. And by the end of it, like even people complimented me and I was so proud of myself because I was this close to rescheduling this presentation because I was so worried about it. And I thought that I needed another week. So glad that I didn't do that. And I got it, I got it done and it went well. And so when kids hear you say that, and you're just, if you notice that I was dropping in little coping techniques, I took a deep breath, and even though I messed up, nobody seemed to notice. That's like a positive self-talk and a plan. Like, what will you do if you mess up your words? You just keep going, right? And pretend that everything's fine. And so you're dropping these little tips, and your kid is going to hear that and pick up on that. And so if you have opportunities in your day, or examples in your day that you can share in that kind of indirect way, that's super good for kids to hear. Also, kids love hearing stories about you. They love it, particularly when you were a kid. And so if there are times where you can share, like, a time when something happened to you that triggered stress or anxiety, but you successfully coped with it, you share that. They love to hear those things.
And I like that it's like a story instead of you're lecturing, because you could sit your kids down and say, okay, you might get nervous about this, but then this is going to happen and you're going to be able to do this and you're going to lose them. But when it's a story, it's a whole different thing.
Absolutely. Okay, so this is just all the things that I went over before, and I just thought I would have it all on one slide. And I think I'm happy to share all these slides, and I have notes attached, and so everybody is welcome to have those. I hope that you guys can send them out.
We'll make sure we do that. Yeah.
So I want to just mention again, these are the two things to think about when you're deciding whether or not your child might need more support. The difference is the severity of the anxiety, meaning it's happening frequently, and the behavior and the physiological manifestation of the anxiety is really high and happening a lot. And also when it starts to interfere with your child's day-to-day activities, it gets in the way of things that they have to do or that they want to do. That's when it's important to consider getting an assessment or getting some intervention. Now, of course, the problem is that the mental health field and providers are, they're all full, right? Mm-hmm. It's really hard to be able to get the support for your child or yourself or your family. So I'm going to share a few things that could potentially be helpful. The first is some books that I really use myself in my practice and my work with other kids and families, and also in my personal life as well. The first book is written by Christopher McCurry, who happens to be a local psychologist, and he's had a practice in the Seattle area for decades. And this book is just wonderful. It's so well written, so practical, and gives a lot of really good language and ideas on how to help your child. The middle book is a book that I use a lot in my practice, and I also use a lot when I was running groups for parents of anxious kids. And what's really neat about this one is it's basically teaching you how to be a therapist for your child. It says it's a step-by-step guide for parents. It is basically a therapy manual with like session 1, session 2, session 3. And it gives you exactly how to do this with your kid. And once you purchase the book, you get access to a PDF that is a child workbook that you can print out and you can fill out with your child. And it's just, it's very concrete if you want to do something that's kind of more therapeutic intervention based. And then the other book is just another one that is easy to read, great concrete suggestions. I really love the way that Reed Wilson writes. In terms of referrals, there is a group of providers on the east side. They have 3 offices. One is in Snoqualmie Ridge, one is in Issaquah, and one is in Woodinville area. This is Eastside Psychological Associates. If you click on that link or Google them, there's a phone number, and I believe they have an email referral form. They may not be able to set you up with a provider at Eastside Psychological, but they will return your call, screen you, and they can provide names of people either at EPA or within the area that might have openings that have expertise in your primary concerns. Seattle Psychology is the same thing. They have offices in Lower Queen Anne and in Wallingford, and they have a referral service as well. And they also have like tons of providers, people who like maybe work there 1 or 2 days a week. That's both a positive and a negative, because they're only there for a short period of time, so they tend to fill up, but there's a lot of providers, so you have a much more opportunity to be able to find somebody who might have openings.
Right.
And then the little poster there is an ongoing group for parents of children who have anxiety. It's a virtual group meeting. It's run by a psychologist and a counselor who I think are based on the East Side, but it's all virtual right now. I don't know if they're going to be shifting to do it in person anytime soon. You don't have to have a diagnosis of an anxiety disorder in order for your child to be enrolled in the group. And this is a parent-only group. The children are not involved. So you would be able to meet for 5 sessions, and you basically go into a lot more detail with some of the things that we discussed.
This is great. And I would say another, first of all, this is great because right now, if any of you need a therapist, it is really difficult to even get phone calls back from some of them. So this is great that they will actually return the call and give you referrals. The other place you can try is if your company has an EAP, they can help you out. Sometimes your insurance companies can help you out. You can get a case manager if you need something. Psychology Today, but there's so many people filled up that it's a lot of phone calls you make from there. But don't give up if your kid needs clinical support. But as Lynette's telling you, it doesn't mean that you have to wait for that support. There's things you can do right now that will make a difference.
Yeah. So I'd love to answer any questions that you have. Please feel free.
Yeah, so let's open this up, and you can throw them in the Q&A box or the chat box. I will be watching those. Now, while we're waiting for any more questions to come in, I'll read you something that somebody else typed in here. My daughter has been complaining for the past few months now of a stomach ache and a headache and doesn't like school anymore. It stems from her teacher getting flustered and angry at the class because some kiddos are hard to handle and she yells at the class. That seems to be what causes her stomach ache. Any advice for this parent?
That's a tough situation. I think it's important first to rule out that there's not a medical cause for the stomach aches. So it's worth a visit to the pediatrician. And at that point, you can be reassured, and you can reassure your child that it's not something serious that is causing their stomach to hurt, and that then you can move on to a little bit of psychoeducation. Your stomach is hurting probably because you feel nervous or scared or anxious about going to school, and then if your child is able to engage in a conversation about what it is that makes him or her feel nervous or scared, and be able to talk about what happened with the teacher. This one is particularly tricky because there's not a lot of concrete strategies that your child can do to change how the teacher is in the classroom. But what your child can do is learn coping skills. So if your teacher yells, what can you do? How can you relax yourself? How can you stay calm? Is there somebody you can talk to? And, to try to come up with strategies for when that situation happens so that he or she feels empowered in the moment that she can cope with it. And then there might be, it might be worth having a conversation with the teacher and potentially even a meeting with all, like your child and the teacher and you, if that's appropriate. It's always tricky without a lot of details to be able to just have that conversation. And it's also hard too, because you don't know if the teacher just yelled once or if this is a regular thing, and kids can be inaccurate conveyors of information sometimes. And so if it was just a one-time thing, that's different than if it's happening a lot. But again, like talking to the teacher about it is probably a really good idea and a good place to start.
Right. Yeah. I think that is really good advice. Like trying to, if you do talk to the teacher, like make sure you're kind of going in knowing that you may not have the whole story, or that, but yeah, maybe worth talking to the teacher. All right. We're running out of time, but I do want to get to these last two questions here. What does clinical support look like?
So typically it'll start with an assessment, and that will help determine if your child meets criteria for an anxiety disorder or has elevated anxiety, and if so, what type, because I didn't talk about this, but there are different types of anxiety. There's social anxiety, separation anxiety, phobias, generalized anxiety. And depending on that, that's going to impact how the provider would work with your child and work with you. It also depends on the age of the child. Younger kids, typically providers are working just with parents. Little kids can learn a few things to be able to help manage their anxiety, but really you're helping the parents be able to act as therapists or coaches in everyday life, because parents are with the kids way more than the kids are going to be with the therapist. And so typically it would look like teaching kids and parents ways to manage the physiological symptoms of anxiety, teaching them this kind of a positive self-talk, Socratic questioning, how to be able to figure out what the worst case scenario is, how you would cope with that. And then a big piece of it would be identifying the primary triggers of anxiety and slowly increasing the exposure of the child to the anxiety trigger or stressor. And so the therapist would help coach the child and coach the parents to bring the child in contact with the thing that's triggering their anxiety frequently until they reach habituation and it decreases, and then they can move on to the next step or the next anxiety trigger.
Okay, great. Lynette, I want to be mindful of your time. Are you able to stay on for just a couple more minutes?
I am, yeah.
Okay. All right. So,
Sherry or Lynette, can you stop sharing your screen so we can see?
Yes.
Yeah, Lynette, I'll have to do that.
Okay, thank you so much.
There we go. Okay, so another question here. How do you get an assessment, and are you accepting new clients?
An assessment would happen once you got into a referral. And so once you made that first appointment, assessments happen in that first session. They can also happen with a pediatrician. Many pediatricians, more and more pediatricians are being trained in how to evaluate and assess and diagnose pediatric mental health issues in their practice. Not all, but most of them are. And so that would be one place to start, and that's how you get an assessment. Mm-hmm. In terms of me accepting people, I do a bit of parent coaching. You're welcome to reach out to me at the email address that I provided.
We'll send that out again in the follow-up emails for sure. It's hard to tell the difference between anxiety and ADHD. How do you know which one it is?
That is going to require an assessment. And you're right. Sometimes they look like each other, and they can also be happening at the same time. And so having a careful and well-trained professional assessment done is going to be the most helpful way to approach that, because it will also determine what appropriate intervention there is, right?
Great. Let's see. My daughter was diagnosed with anxiety disorder 4 years ago when she was 5. Since then, she's been in therapy, but we don't see much progress. Does it mean she needs a different type of therapy, or she needs medication, or something was misdiagnosed? What are your thoughts on this?
I think that it's time to have a conversation with the provider without your daughter present, and ask whether or not your daughter should be reassessed. Express your concerns about the progress, get a very clear what the treatment plan is, what the goals are, how ask the therapist, how are you monitoring progress? And depending on how the therapist responds to that, that might help you know whether or not you might need to find a new provider. There are lots of approaches to anxiety, and the one that I've been talking about during this presentation is coming from what's called cognitive behavioral therapy, and that's the one that we have the most evidence through research to support that it's effective. But there are plenty of providers who do different things. They might be doing play therapy or attachment-based therapy, and that might not be the right fit for your child or for your family, and it might be time to try something different to see if it might be more helpful.
So true. Someone in the chat box here says, kids are coming home witnessing a lot of tough behaviors in the classrooms, holding it all in. Do you think there's something schools can do to relieve anxiety during the day? I will give my quick answer to this one, Lynette, and then I'll let you this one. Yes, there are things they can do. Are there things that they will do? That's a different story. But yeah, they can add in some, I'm not even gonna go there because we don't have enough time, but there's lots of things, and you can always reach out to your school and bring up this concern and see if there's something that they are willing to do. Lynette, your take on that?
I agree with you 100%. I think there's just not enough time, and resources are stretched so thin, and these poor teachers. I mean, my daughters, my twins are in first grade, and this is their first time ever in a classroom. And so, of course, like, the kids don't know, they spent all of kindergarten doing remote kindergarten, which is crazy. And before they were maybe in preschool for half a year. So of course we're seeing behavioral problems. And yeah, it's just a really hard time right now. And we just don't have the resources and the money or the time that's being devoted to it as I think it should be.
Yeah. Yeah. So one thing you can, knowing that when your kids get home from school, give them that de-stress time, things to help them to kind of come out of that. If you know they are in a particularly difficult classroom, just help them de-stress on that and talk it out if they need to. They may just want to play it out, you know, not talk about it. So, all right. Okay. We are over time. So I appreciate you sticking around and answering the rest of the questions. So thoughtful of you. We will be sending like a email after this to everyone who's registered with how to get in touch with you. And we will make sure we give access to the slides and all of that good stuff. If any follow-up questions come up, Lynette, we will forward those to you. And before everyone takes off, I'd love for you to put your aha moments in the chat box so that we kind of know what resonated with you. And we also wanted to remind you that tomorrow is the Lake Washington Schools Foundation Bridge the Luncheon, I think is what it's called. Somebody help me out. Bonnie, Val, one of you.
Be the bridge.
Be the bridge. Okay, I was close. But this is the funding for Parent Chat, for instance, and for all of the programming that Balance in Mind does. We get funds from Lake Washington Schools Foundation. So that is a great opportunity to see what they're up to and to really support all the causes that Lake Washington Schools Foundation is supporting, including us, Balance in Mind, so we can keep bringing great information your way. Lynette, thank you so much for imparting your wisdom upon us and answering questions tonight. It was very, very helpful. And what a great way to kick off, having more parent chats that are geared towards the elementary school kiddos.
Excellent. Thank you so much.
Thank you.